I am Kevin Trudeau, and you're watching A Closer Look. Canada is in the headlines again, this time with a potential new discovery for the reversal of diabetes. And my guest today to talk about it is Dr. Young-Soo Kim, Ph.D., MIT. Dr. Kim, thanks for being with me. Now, you're not the inventor of this discovery, but you discovered this discovery.
That's correct. Actually, I was a professor at the University of Alberta teaching finance, and I started my own financing company. I was quite successful. And having known that, the government of Alberta invited me to look into our technology, in which they spent a huge sum of money, which was this very technology, Eleutin technology. And then I started looking into it, and I found out that about 20 years ago, a 70-year-old, very frail, sick lady who had a serious diabetes and kidney failure.
Series 1 or type 1 or type 2 diabetes?
Type 2.
Type 2 diabetes.
Yes.
Now, type 2 diabetes is the most common, correct?
Yes.
And that's
adult onset diabetes.
Okay.
Yeah. And then because of the serious gangrene ulcers, she had to have both legs, not the feet, amputated. So
she had to have both legs amputated because of her diabetes.
Yes. So she was checked in for that operation. And when she was told that option, she refused to have the operation. She wanted to live shorter but with dignity.
And how old was she?
70.
And where was she living at the time?
At the time, Calgary. But she was
in Calgary, Canada?
Yes.
Okay.
But she was originally from Malaysia.
From Malaysia, so Asian woman?
Yes.
Okay.
And she just refused the treatment and checked herself out. And in 6 months, she came back completely cured. So
no diabetes
no
at all?
Diabetes, no kidney problem, every symptom gone.
Now, how long ago was this? Did this happen?
This happened about 20 years ago.
20 years ago,
yes.
Okay.
And that triggered, of course, the curiosity and interest of the University of Calgary, which is one of the most prestigious center of diabetes studies in North America. So they sent our team to check out what this lady did.
This was 20 years ago.
20 years ago.
Right.
And then they found out one herb that contributed to this remarkable improvement of this lady's.
So not a drug, an actual herb.
Yeah, and the herb was classified as food in Southeast Asian countries.
Okay.
And then, after having seen this, the nurse, who has herself a very serious diabetes, she just volunteered herself, try it on me, try it on me. She also had completely cured. So they put a serious study teams on these herbs and found...
So the University of Calgary?
Yes.
The university itself?
Yes.
20 years ago put together a group of people to research and study this particular group of herbs?
Yeah, exactly.
In treatment of diabetes?
Yes. And they studied on animals and humans. So they just... So originally the name of this product, Eleutin, was Pt.1 because they did 700 times of the studies and tests. And so I just noticed this product, and since then my company acquired the technology from the Alberta government and University of Calgary, and then we developed this product, Eleutin. Yeah, right now we have 40,000 users.
So you call it Eleutin?
Eleutin.
And it's basically three different, and it's not a drug?
It's not a drug, it's food.
It's a food product?
Yeah, actually the Chinese government, Taiwanese government, Korea, Japan, they issued the seal of approval of safety as food. Actually, safety as food is more strict than safety as a drug. This is a very, very safe product.
Now, right now, diabetes afflicts how many people worldwide?
Worldwide?
Tens of millions?
More than that. It's just in the States, 60 million diagnosed, 20 million, yes, just in the States, 20 million.
Right before getting diabetes, or kind of predisposed to diabetes?
No. People
who actually have it?
Yes, 20 million.
There are a lot of people in America or around the world that have diabetes and may not even know it.
Yeah, usually, on the average, half of them don't know they have diabetes.
So there's a lot of people right now who have diabetes.
Yes.
Explain exactly what diabetes is.
Technically speaking, people who shows the blood sugar level higher than 150 before meal. But more than that, they have complications. So for example, the 50% of blindness comes from diabetes. 50 to 70% of male impotence comes from diabetes. 50 to 60% of amputation come from diabetes. So diabetes opens the door to a whole bunch of other serious diseases.
So diabetes is high blood sugar.
Yes.
Now, as opposed to hypoglycemia, which is low blood sugar.
Yeah.
So when people have high blood sugar, now my father, for example, has diabetes. And originally he had to manage his food. You know, he had to watch what he ate. Now he has to inject himself with insulin. So what other treatments do people right now take if they have diabetes?
Yeah, just let's talk about that diet and exercise. Only 1% of people succeed in controlling their diabetes with exercise and diabetes. We are talking about those super wilder people. You cannot expect that thing to succeed for ordinary people. And other options people have now is that those pharmaceutical drugs, those oral...
Pharmaceutical drugs?
Yeah.
So people are taking drugs or insulin to control diabetes?
At first they take pharmaceutical drugs first, and if that thing doesn't work, they start to take insulin injection. The problem with pharmaceutical drugs, they all have a serious side effects. And usually at the end of the 7th year of usage, they don't work anymore. So people develop the resistance to it. So half of the kidney failures of diabetic patients actually come from the pharmaceutical drugs.
So the half of the kidney failures don't come from diabetes, come from the drugs that people are taking.
Serious side effects. So doctors are always so concerned about the side effects of the drugs.
Now this was a 20-year, I was reading here in the Medi report, this was a 20-year study.
Yes.
Conducted by the University of Calgary?
Not all 20 years, but for the first 10 or some years.
The university actually did the study?
Yes, and there is a diabetic research center called Julia McFarlane, a Center of Diabetic Study. It's one of the most prestigious diabetic research center in the whole world. Yeah, and I think there are more than 100 PhDs there.
Now, all the people that have been tested on this, certainly not everyone has seen the results, correct?
Studies say 98% of people experience major drop in their blood glucose level.
The blood glucose levels?
Yeah.
98%?
Yeah, but of them, 70% become normal. And
totally normal?
Totally normal. Don't need any medication, don't need even the L-leotin itself.
Now, one of the other things it mentioned in this is it mentioned if people stop taking it, that their blood sugar levels still remain even though they're not taking the herbal supplement.
Correct. Correct. And then on the top of that, all the complications are gone.
All the other complications with the diabetes.
Yeah, I have my uncle who became almost blind, and then toes became so infected, just about to have amputation, all normal. Now don't even take injections, insulin injections anymore.
And are there any side effects to this? Because this is not a drug. Although, you know, it kind of looks like a prescription, but it's not. It's an all-natural herbal supplement, correct? Are there any side effects that you know of?
No. So the the ingredients, they are all good for your health anyhow. I take even though I don't have diabetes. So no side effect at all. That's one of the strengths.
Now this has made newspaper headlines.
Yes.
All throughout Asia, correct?
Yes. Yes.
Because this is, would somebody classify this as a, I guess it couldn't be called a medical discovery because it's not a drug. But would you say, in your opinion, it's a medical discovery?
Whether it's a medical or as opposed to dietary? In Asia, they all claim this is a medical breakthrough. For example, Chinese Diabetes Association call it final cure. They call it final gospel. You know, I found this quite interesting. It's the atheist country. They call it final gospel. And then Korean Diabetes Association say breakthrough cure.
But in America, you can't call this a cure.
That's what I understand. But I don't have to say so because all other people say so already.
In other countries.
Yeah.
But technically, if a person has diabetes and he's like my dad, I mean, the guy takes insulin. If I tell him to take this, which I'm going to, he's not going to just stop instantly getting his insulin injections. I don't want any problems.
That's very important because the effect of L-leotine takes a long time, like say 3 to 4 months. But before L-leotine takes its full effect, one still have to rely on this traditional treatment.
So they just can't stop taking what they're taking?
Yeah, but in the meantime, they'll experience the improvement of their general health as well as the dropping of blood glucose level. Then they feel the need to see the doctors to reduce their prescription.
Now, you're not a medical doctor. You're a PhD from MIT.
Yes, correct.
Okay. But you're not an MD?
I'm not.